Democratic State Representative Nicole Collier of Fort Worth, thank you so much for joining us. We appreciate it. So here we are, the legislative session, the 88th legislative session is set to begin, and I'm wondering, what are your priorities this session?
Wow. Thanks for having me, Jack. Now, that's a loaded question there. There are so many things that, I'd like to see happen in the upcoming legislative session. After speaking with the residents of House District 95, we've developed a plan of legislation that would help support the efforts of our community. Absolutely, we're looking forward to some property tax relief for those homeowners in our district. We're looking for protections for renters in our district as well. And we're looking for also some second chance legislation for individuals so they can get back to their life and live with dignity and respect, as well as being able to care for themselves, earning a livable wage. So there's a lot of things that we're going to address, like environmental justice. I mean, Jack, you just asked me a question and you opened up a whole can of things that I get excited about that's going to help our community.
One of the things, of course, there's so many bills that have already been filed before the session begins. But as you know, there's only one bill that's really required of the legislature, and that's the budget. And one of the things that we keep hearing is that there is a record surplus. And so I'm wondering, you mentioned property tax relief. Governor Abbott campaigned on taking half of the projected surplus, about $27 billion. So that would be $13.5 billion, and apply it to property tax relief. Where are you on that?
Well, I haven't seen anything, so I'm not committing to any type of policy right now, but there is a need. My understanding is that the lieutenant governor has not agreed to that. Also, we're hearing that the surplus may be more than $27 billion. So, if we have, this much money, of course, we want to address property tax relief, but we also need to address the healthcare shortage in terms of healthcare access. There's so many people who don't have health insurance, and we could use some of these dollars to increase access to health insurance and also increase the Medicaid reimbursement rate for our healthcare providers.
And I was going to ask you, when you talk about access to healthcare, are you speaking specifically about expanding Medicaid in Texas?
Of course, I'd like to see that happen. I think the appetite by the Republicans is fluid. We've seen them come closer to engaging or at least entertaining some type of additional coverage, but not with exactly Medicaid expansion. So we're not there yet, but they're working on coming up with ways to address this gap in health insurance. But I don't think it's going to meet the needs.
You and I have talked a lot over the last several months since Uvalde and the tragedy there about school security. And so I'm wondering, how much money do you think the state is going to commit to making school campuses safer for our students, and at the same time, mental health as well?
Well, hopefully the past is not an indication of how much money the state is going to spend on our schools, because the state, and I include myself because I'm a member of the legislature, but I don't support that, have continuously underfunded our public schools. They don't have the necessary funding to purchase the resources that they need to reinforce our schools. The alternatives that the state has proposed by arming more teachers and educators is not going to do it. That's not going to make our schools safer. So yes, we do need to make sure that the schools have the funding to implement those procedures and policies. There's been a procedure, there's been a law that's been filed by a member of the Texas Legislative Black Caucus that would require one entrance into these schools. That's something that would need to be done to alter the new schools that are being built. So yes, we need to add some more of this money to our public schools, but we got to fund them the way they are now. That means we got to fund the students Average daily attendance, we got to look at that. Is that meeting the needs of the students due to the pandemic where, we have a lot more absences? But yes, we need to do that. And also in terms of mental health, we need to provide funding so that the schools can hire and pay for mental health providers. The counselors that they have in place, they're not always used in the capacity that they have the training for. So we definitely need to look at making sure that our schools are funding and paying our teachers adequately, because we do have a teacher shortage, and the pipeline is dwindling. So we need to make sure that our teachers receive adequate funding, our schools are secure, and not only our public schools, but our colleges and universities as well.
And you mentioned teacher pay. Does the state need to contribute a boost in pay so that the school districts can offer teachers a higher salary?
I don't know if that would be an exact line item, but we could definitely pay or contribute more to the other items, so that way it offsets the obligations of our current schools, of our schools. So that way they have the dollars to pay. Dallas ISD had this merit type of outcome performance pay schedule and structure that is pretty much well received at the state level. And there's talks about mimicking that across the entire state. So these are things that we could look at and consider as we move forward.
You mentioned one other thing, and that was the absences during the pandemic. There was a lot of learning loss. So how do you think that, and what have you heard from educators about how the state can address that?
Well, there has been a lot of learning loss, increasing and funding wraparound services, so that way our school districts have funds to do more after school programs or offer programs that could help offset that loss. The schools are very innovative. They come up with great ideas, but do they have the funding to implement them? And that's the problem. And we at the state level can help ease that burden by providing adequate funding for our public schools. So that is one thing that I want to make sure that we do focus on, these wraparound services, to make sure that that the needs are met, and then not penalizing our schools, because when they're if we deal with funding based on the average daily attendance, that average daily attendance number can fluctuate if someone catches COVID or is exposed to someone with COVID. So we need to reevaluate how our schools rely on this average daily attendance to as the base of their funding.
Wanted to ask you about the grid. Obviously, the storm 2 years ago, a lot of people died, unfortunately, in that because of the mass power outages. The state took some action. The legislature took some action as far as weatherization and making sure that these power plants and other facilities are doing what they can to protect them from the cold, the severe and bitter cold. And now ERCOT and the Public Utility Commission of Texas are really trying to redesign the electricity market for the long term, so that, before the emphasis was on cheap energy, now it needs to be on reliable energy. And so how important is this issue, and that the legislature put its stamp on what ERCOT and the PUC come up with?
Well, it's very important that we address the power grid. One of the things that we have not sufficiently done at the legislative level is address the natural gas portion. Now, you mentioned weatherization, winterization. In terms of the electric market, yes, they addressed a lot of the shortcomings that we saw in that market, but we didn't get to the root of natural gas. Natural gas is what powers up the electricity. And if they can't power it up, the electricity doesn't work. So what the legislature did was only require winterization of those critical infrastructures for natural gas. Not everybody lives in a critical infrastructure area. So there's still going to be a lot of people that may endure power outages due to the not being or living on a critical infrastructure grid. So that's something that we need to look at as well. And so if we go back and tackle that issue, which is very difficult because the lobby for gas is strong, but there should be some ways that we could compromise and work on reasonable solutions for the people of Texas that could shore up and stabilize our power grid.
Now, the Railroad Commission did issue new rules that have now gone into effect. It took an extra year to put those into effect. Are you saying there needs to still be a review by the legislature on that?
Oh, yes, because the natural gas, if we're talking about the bill that was passed from last session, it only dealt with critical infrastructures for our natural gas. And again, they have to ensure, so that way, for instance, in Fort Worth, our water system failed because we didn't have power. That's a critical infrastructure for our community. And so in the future, the gas companies have to identify those critical infrastructures like our water company, our water plant. That's a critical infrastructure. We got to make sure that they don't lose power. But that doesn't mean that me living in the city of Fort Worth and East Fort Worth, that I'm protected or that my power is going to stay on because I may not be on that critical infrastructure grid. So I think that we're in the right direction, but there's more that can be done to reinforce and stabilize our grid.
Wanted to ask you about some other issues that have been in the national headlines. And first of them is abortion. Obviously, state law changed last year after Roe v. Wade was overturned. And so I'm wondering, are you proposing any legislation in the coming session that would change state law when it comes to abortion?
Well, I haven't proposed anything, but we've got to be very careful as those who support the right and the freedom to choose, because the legislature is stacked. There's more Republicans than Democrats, and so when you start adding on bills or promoting bills, it can get very harmful. It can be more harmful than good. So, no, I don't have anything right now. We're still trying to get clarity on the existing rules and laws that are in place. For instance, is someone who assists someone who goes out of state to obtain an abortion, are they subject to criminal charges or any type of civil penalties? And so I've sent a letter to the Attorney General's office asking for clarification after I've worked with the stakeholders in that, and no response whatsoever that would provide an answer to that question. So, those are things that we want to look at, but also, we're looking to at the federal level for more assistance because we just don't have the votes to get something reasonable and meaningful done, any type of protections done for those who want to exercise their freedom to choose.
When did you reach out to the Attorney General's office seeking an opinion?
It was in November. It was right, I think it was like November 8th or something, 7th or 8th, or maybe the answer was due November 7th or 8th.
And you didn't hear?
Oh, no, we did get a response back. And they said that they're not responding. Basically, it was like a
Ah.
no response.
So let me ask you one other question about this. There seems to be agreement between some Republicans I've spoken with and Democrats about boosting the budget for care for expectant mothers and for mothers postpartum after they give birth. What are you hearing about that?
Well, that would be great if we could make sure that the Medicaid is in place for the 12 months, the full 12 months following the birth. We know maternal mortality is high in Texas, with Black women seeing the brunt of that, harm. So we have to make sure that we do have things in place and true, meaningful healthcare. With this public health emergency, right now we have continuous coverage of Medicaid, but once that ends, Medicaid individuals who are on Medicaid right now will have to reapply and become eligible again. And so we're concerned about the drop off from that process. Will people still be eligible? Will they actually fill out all the forms? So right now, 6 months, you get 6 months continuous coverage. Well, I say right now because the federal government didn't approve it. And so we're working on hashing those details out. but we just really need to do 12 months of continuous coverage once this public health emergency ends or more. I mean, if we could get the bill passed. But right now, there is concern about the healthcare of the parent, of the mother following the birth, and making sure that they have the resources to get the care that they need and deserve for not only themselves, but their child. So that is something. And then also, we're hearing about these alternatives to abortion clinics that aren't even ran by healthcare professionals for the most part. They are, I guess, I don't know if I want to, if you want to call them, they are proposing to be clinics that provide care, pregnancy related care. But what they do is encourage an individual to go through with the pregnancy, and they're supposed to connect them with the resources, but we just don't have those resources in place. We don't have enough resources in place in Texas, especially in rural areas. And it's more of the state putting their ideology of abortion and anti-abortion onto the individual. And so, when you have these clinics where a person goes into and they are encouraged to go through with the pregnancy, regardless of the circumstances, you're re-traumatizing the individual. And we at the state level we're not prepared to take on all the, that comes with all this, these individuals having babies. Our foster care system is not strong. Our school systems need help. We have too many people in prison. So, all of these structures and systems that are in place are maxed. And then by requiring somebody with a gestational mandate to have the child, to carry the child to term, it won't do us well in the long term.
Wanted to ask you about border security. As you know, the state has increased the amount of money. Now it's $4 billion to address issues at the border. Do you agree with the increase? And what do you make of the fact that President Biden is coming to Texas and going to the border for the first time in his presidency?
Well, that's definitely needed. President Biden inherited the policy, the Title 42 policy that was in place because of the pandemic. And what that says is that you can expel migrants who don't have status. And so that's what's been happening. President Biden's administration has attempted to ease and remove that, but the Supreme Court of the United States declined, and now it's still in place. So, we had people who were in the process of getting their immigration hearings done, but when that Title 42 was implemented, that stopped. So the individuals who were in Mexico, a lot of them were waiting for their hearings because they had to wait outside of the United States for the hearings, but those hearings have been postponed. So you've got a lot of people on that border who are living in precarious conditions, just waiting for their status to be, heard, to hear, if they're seeking asylum. Those asylum seekers don't even have the ability to seek refuge in the United States. So there is something we have to take action. I would like to see the Biden administration do a little bit more, but they are taking steps to, address the increase in migrant crossings in Texas and across this country. I don't think that the $4 billion is appropriate overall. I think that there's other ways that we could address this issue, working together instead of just pointing the fingers at each other and slamming each other, in the media. Let's sit down and have those conversations and talk about how we could work together to reduce the migrant crossings that may pose an economic burden on those communities.
Do you think that, do you have a dollar figure amount? Let's say instead of spending $4 billion, how much do you think the state should be spending? Half?
Well, I don't know. I mean, literally, are they, I don't know. I don't have an exact number, but 4 billion just seems like a lot. And is it is it meeting the goal that is intended, that it's intended to meet? If the goal is to hire, hundreds of people to stand at the border and prevent border crossings, then no, it's not working. The $4 billion is not working.
And my last question to you, just about the politics going into the session. There are a variety of Republican lawmakers and the Texas GOP are calling on the speaker. It very likely will be Dave Phelan again, but calling on the new speaker to change the rules so that Democrats are no longer committee chairs in the House. Where are you on this?
Well, I mean, I don't have a say on what happens with the speaker's position on that, but I'm hearing that that is not going to happen, that, there's still going to be some Democratic chairs. That, I mean, everybody keeps saying, I was at an event yesterday and I was with Representative Gio Capriglione from South Lake. And the first thing that out of his mouth was, we're not Washington, D.C. Our colleague, we get along with our colleagues. And if that's to hold true, then we won't see a policy like that implemented at the state legislature.
How important is it to you that Democrats have some chairs for over these committees?
Well, it's vital to the process. You need to have diverse perspectives, and each party, whoever's in charge, whether it's a Democratic speaker or a Republican speaker, they found ways to have a coalition or have collaboration from both parties. So in the past, it's worked. Whether you put, and they do it by stacking committees. You get a committee, you put more Republicans on there than Democrats, but you still get that opportunity to have a seat at the table and to help craft policy and shape legislation in Texas. So it's very vital to maintaining diversity in our state and diverse perspectives. So I think that it's a vital issue that must stay in place to keep Texas from being Washington, as the Republicans so say.
Democratic State Representative Nicole Collier of Fort Worth, thank you so much for joining us. We appreciate it.
Thank you, Jack.